Hello everyone, my name is Dr. Vallabh Chawla and today we are going to study about tooth anatomy as seen in a CBCT sectional scan. Okay, so basically tooth anatomy includes enamel, dentine and pulp. These are the three main landmarks seen in a tooth. So coming to the first landmark, enamel, this is the radio opaque structure that is seen is nothing but enamel. It appears whitish in color in a CBCT scan. The grayish color just below the enamel is the dentine as seen in a CBCT scan. This is dentine, and the radiolucent structure seen in a CBCT scan is nothing but pulp inside the tooth. Okay, so this is coronal pulp. This is the coronal pulp. This is the pulp horn. This is radicular pulp as it goes down, and sometimes there may be some kind of radio opacity seen in the pulp, which is nothing but pulp stone. Other anatomical landmarks include lamina dura, which is seen just besides the radicular pulp, just besides the root. These are the tooth roots. So this radio opaque line which is there is nothing but the lamina dura, and just in between the lamina dura and the tooth root lies the periodontal ligament space. The periodontal ligament space appears completely radiolucent in structure, and in cases of trauma or in cases of apical periodontitis, the space may widen up, and in cases where the caries, if they approach completely approach the pulp completely, so the lamina dura may get lost and pathology periodontal pathosis may be seen, which appears to be completely radiolucent. Okay, so basically in this case, this is the radiolucent caries that is seen approaching the enamel, dentino enamel junction and involving the dentine. It has not approached the pulp. Same thing can be seen in other cross sections also. This is the coronal radiolucency as seen. It has involved the dentine. We always have to cross check with other cross sections as well. Okay, as we see in this case, there may be slight widening of PDL space noted. Okay, and similarly other teeth should also be studied. So in this case you can see there's another caries seen. Okay, so in this case it is again in like not approaching the pulp but in close relation. If left untreated, it may lead to uh, the patient may have to undergo root canal treatment. Okay, so this was the basic anatomical landmarks. Other landmarks included in this case are the alveolar bone. This is the alveolar crestal bone. This is the alveolar bone. You can see bone trabecular pattern. Usually it's very important to see the bone trabecular pattern and the density. As you can see, it helps in implant planning. And other landmarks includes the nerve canal cortex. This is the superior nerve canal cortex, and this is the inferior nerve canal cortex of inferior alveolar nerve. And this is the mental foramen region. As you can see, just have to go down. This is the mental foramen seen in the coronal cross section. Also, it's one of the important anatomical landmarks during implant planning. It opens up on the buccal aspect. So this is the mental foramen and the inferior alveolar nerve, very important anatomical landmark for during implant planning. And this is the inferior border of the mandible. So these were the basic anatomical landmarks as seen in the CBCT scan.